Hello guys, this is Katia. Today I want to share something that I have learned a few months ago, and it is how to draw blood. I found this super interesting because more than think about that it could be easier just to insert a needle and take the blood out, send it to the laboratory, and done. Exactly, technically, it's something like that. But you have to know some certain things to make it well, to do it well. So let me start to explain um, the steps because it's more than 3 steps, so I don't want to make this too long. So we're gonna need a gloves, alcohol swab, a tourniquet, a syringe or vacuum tube system, a gauze, and a bandage. Okay, so we're gonna put the tourniquet 2 to 3 fingers up from the middle where your elbow it is. You're gonna put the tourniquet, you're gonna tell your patient to make a fist. So you're gonna start looking for the vein. So you're gonna use your middle finger to start seeing where is the vein. It has to be, you're gonna feel it bouncy. Once you already found your vein, you're gonna remove the tourniquet because you cannot leave the tourniquet more than a minute because otherwise you're gonna hurt the patient arm and the vein, and we don't want that. After that, you remove it. You're gonna put your gloves on. You're gonna disinfect the area using an alcohol swab, starting from the center and to the outside by making circles. And then you're gonna let it dry while you already got everything ready on your table, your gauze, your vacuum tube with a syringe in it, like the needle, could be the butterfly, also the gauze or the band-aid. It always change. Okay, so after the alcohol from the patient arm is dry, because also that can affect the test result if you don't let it dry enough, if it's still wet, the alcohol in the patient's arm. As well, if you leave the tourniquet for too long in the patient arm, it can cause alteration in the results like high level of calcium. So we don't want that. Okay, so you're gonna apply again the tourniquet because that's gonna help you with the flow of the blood. And with your strong hand, you're gonna grab the syringe with a tube system, vacuum tube system, I'm sorry, and you're gonna hold it like this, You're gonna hold the tube from like this, not from the needle. You're gonna hold the tube like this, or if it's the butterfly, you're gonna obviously hold it for the butterflies because they're like this, and here is the needle, so you're gonna hold it like this from the butterflies. So you're gonna hold it and you're gonna make anchor with your thumb or finger of your left hand if you're right-handed, and then you're gonna insert the needle to 15 to 30 degrees angle, softly but quick, because you don't want the patient to feel everything and you don't want your patient to feel pain. So you're gonna do it quickly but soft, and it has to be like kind of like the half of the needle has to go inside, but not too much, because otherwise you're gonna go through the vein and we don't want that. Excuse me. And after that is ready, you're gonna start filling out your tubes. After the last one is already half full finished, you're gonna remove the tourniquet and you're gonna let the tube finish to full in. And then you're gonna put everything on the side with your left hand, or Also, never ever leave the syringe or the butterfly to be alone. Always hold it, because otherwise you're gonna cause damage in the pain, and it's gonna hurt really bad for the patient. To the patient. I'm sorry. And then you're gonna grab the gas with your left hand, put it over the needle, but not pressure, just like over, but not over, like in the air. So when you're gonna remove the needle, you're gonna right away put pressure on, and you're gonna tell the patient, "Hey, please, no, like, excuse me, can you please put pressure on the on here?" So you're gonna leave them to do a pressure at least for a minute, and if it doesn't, the blood doesn't stop coming out, you can tell them to put their hand up. That also helps to make the coagulation work fastly. After everything's done, you already took your needle, your vacuum tube system, you put it in the safe container, the hazard container, that you throw away the hazard things. You're gonna clean your table, and then you're gonna check your patient. If it's clogged, it's great. You can go ahead and put the bandage, and he's gonna be ready to go. But also, I forgot, super important, you gotta always put the patient name on the tube, the date of birth, the time that you took that sample, and it depends of the tube, it's gonna be different care. So, like, there's one red tube that you don't have to, do anything. You only have to leave it on the side for 30 minutes out to 30 to 60 minutes, because that tube needs to be coagulated. That's the purpose of it. So for some tests that you're gonna run, but that's most information. So I think we're gonna leave it like that. It's a little long, my video. I hope you guys understand me, or otherwise I'm gonna have to make another video for you. Just kidding. But alright, thank you so much. I hope everybody's good. After all of this raining that is been happening, I've been seeing so many friends of mine getting accidents in the highway. So be careful out there. Be safe, and I think we'll be hearing out about you guys soon, because there's so many assignments that we're gonna be submitting for this month. So have a good night or day, and we talk to you soon. Bye.